Hi, lovelies. Welcome again to my channel. This is Nicole, and you are joining me here at Underneath Her Skin. So today I am here with Miss Nicole Casbar, a warrior from the lupus community. She was diagnosed with lupus, and we are here because May is Lupus Awareness Month, and we are here talking about lupus and the challenges that individuals living with lupus face on a day-to-day basis. And I want you to join us. If you are new, please like, share, and subscribe to my channel so that you will not miss another awesome, important video. Let's join the conversation, okay? Thank you again, Ms. Casbar, for joining me here today. And we're going to continue our conversation about living with lupus. So in our first video, you talked about what took you to being diagnosed with lupus and how that has changed your life. And now we are here talking about life after being diagnosed. And I definitely see that you have a lovely butterfly behind you. And I want you to explain to us, because not everyone will know what that means. And I would love for you to explain to us, what does the butterfly, and a purple butterfly at that, what does it represent?
So as you know, May is Lupus Awareness Month, and the color for Lupus Awareness is purple. But the butterfly is a symbol for lupus as well. And the reason why it's a butterfly is symbolizing the typical rash that a lupus patient may have that goes across the bridge of the nose and along the cheeks, and they call that the butterfly rash. So yeah, that's why I have a big butterfly flying above my head, nice and beautiful and freely, but it is a symbol for lupus.
Absolutely. Thank you so much for that. And as we're, a beautiful butterfly, and as we're going into this series, I want you to tell me, one of the main things that happen to individuals who are living with lupus is they get a flare up, which is, it vary basically depending on the individual, and sometimes different flare ups. So can you explain to us, what is a flare up like for you?
So for me, a flare-up is typically, it usually starts with more joint pain than usual. And in general, a flare-up means that there's a definite marker for increased activity. So if you weren't, so to speak, having a blood test to see that increased activity, you're going to notice changes to how your body is responding, whether it's more pain, whether it's something new that's developing, etc. So for me, though, it's usually more joint pain it starts with. I also get little, I don't even know what to call them. They're like these little bumps under my skin that are along all of my joints. I actually have one right now on my index finger, so I'm touching it. They're like little nodules, so to speak, along each of the joints. I will get that everywhere eventually. I also get sores in my mouth and in my nose. Those are like the beginning signs. Then the rash, for me, it's very rare that I get the rash on my face, or if I do, it's only for a short period of time. It's usually, as I said before in the other video, on my chest and on my legs.
Yes.
And then I sometimes will get sores on my skin that are extremely painful, and that's when I'm in really, really bad shape. I do have asthma, so sometimes there will be some lung involvement. I'll notice some increased activity with my asthma, because usually my asthma is only allergy induced.
Right.
But if I'm in a very bad flare, I will experience more asthma symptoms. And luckily, I don't have kidney involvement yet, and I'm hoping I never do, but that I know is another issue. Oh, my stomach too. I have very bad GI issues.
Okay. Is that because of lupus? Is that another condition, or?
Yes, it can be either, or it can be from a flare-up due to lupus because of inflammation of the bowels, but it could also be due to the medications that we take. So I'm not really sure which. In that case, I'm not sure which way that goes.
What causes what? That's definitely sound like it would be hard to decipher, because there's so many things happening all at once. it's really hard to tell. But I definitely like that you mentioned medication, because this is something that I wanted to find out what helps you, even the bumps that you mentioned beneath your skin. How do you how does it go away? And what kind of medications are you taking that has helped you or is helping you?
So when I'm in a flare, typically I'm told to increase my steroids, but steroids are, a blessing and a curse all at the same time. I've
Hmm.
had many, many side effects from steroids, including incredible weight gain.
Hmm.
As a professional ballet dancer, I was
Right.
very skinny, in shape, and now, due to many years of steroid use, I gained a ridiculous amount of weight, and especially like you get that moon face or whatever.
Hmm.
I had issues with my teeth due to steroids, and now I'm a full diabetic. Type 2 diabetes is a
Wow.
side effect of long-term steroid use. So unfortunately, that's just introduced a whole other disease. So when somebody
Hmm.
tells you, okay, you're in a flare, increase your steroids, that's
Right.
the last thing I want to do.
Right.
But that is one of the only things that will, get me going and get me out of that flare.
Mm-hmm.
Um, Painkillers do, for me personally, don't do anything.
Okay.
For
Is there
me,
a particular painkiller that they would want you to take prescribed by your doctor or?
I've been given everything from Tramadol, Vicodin. Well, first of all, Vicodin and any of those drugs, I can't take. My stomach can't handle them. I
Okay.
just vomit
Probably
from
because
one
of the
pill. So
GI
to deal with
problem,
the pain.
right?
Yeah, yeah,
Mm-hmm.
yeah. But in terms of the other, they really don't do anything. The only things I've found that help are anything that gets rid of the inflammation. So
Okay.
simple Advil will do that.
Okay.
It'll help like ease up, but that's not good to have too much Advil either.
Right. Right.
So I just kind of try to deal with the pain, and that's it. But yeah, in terms of medication, I'm on a lot of medication.
Mm-hmm.
I'm taking, beside the steroids, which I've been on for 9 years now. I've been taking Plaquenil, which you've all heard about in the news. It's hydroxychloroquine.
Yes.
On
I've heard
that
it with
since
that
the beginning.
name. Mm-hmm.
Yes, there you
Mm-hmm.
go. It's Plaquenil, which is actually an anti-malaria drug.
Mm-hmm.
A lot of people don't know that, but it is. And I don't have really any side effects from that one. I just have to make sure I get my eyes checked at least once a year because that can, do some damage to the eye.
Mm-hmm.
I do take, for lupus, I take weekly injections of Benlysta, and I
Mm.
do those on my own. And I go every 6 months for a infusion called Rituxan. It's two infusions every 6 months, so it's four total for the year, and those are 6-hour infusions.
Oh, wow.
And yeah, and the combination of Plaquenil, steroids, Benlysta, and Rituxan, those are all immunosuppressants.
Mm.
So in the Benlysta and the Rituxan are like intense
Mhm.
immunosuppressants. So for me during this pandemic right now,
Mhm.
I've been literally in this house since it began. I mean, I had well, besides the ones I just had now, I had an infusion of Rituxan last March, and then the whole city shut down, and
Wow.
I haven't been out since. I can't go near people other than my family. I still can't. It doesn't matter about masks or anything because of
Right.
all these immunosuppressants. So that's been a big, big challenge. It's my medication that's really going to harm me more in terms of this pandemic. So I've been in a constant battle with that. And I also did a little research about um, taking the vaccination
Mhm.
with for COVID, with all the
Yeah.
immunosuppressants I'm on. Basically, my doctors are, concerned not about a response to the vaccination. They're more concerned about, with all those immunosuppressants, will this actually,
Work.
work?
Yeah. Wow.
It may
Wow.
not be, yeah. And so they're basically, I know Johns Hopkins University, as a matter of fact, is doing a study on people like me who are on a ton of immunosuppressants. They're going to test the antibodies before, during, and after the vaccination.
Yeah.
And they be a part of that study. And that's great, because then I'll know if the vaccination's even, going to cover me or not. I don't
Absolutely.
know if it is. So it's been, but then I'm also on a bunch of medications for diabetes.
Mm-hmm.
I'm on Ozempic, metformin, insulin. I am on daily insulin at the moment. I wear a little monitor on my arm.
Wow.
And then I'm on, like, I have to take a medication for my stomach. What do I take?
Mhm.
Prilosec. And then because of all these other medications, now I have to watch my blood pressure. And these are
Absolutely.
things I never, ever
That's a
had
big
an
deal.
issue before this. Yeah. So some of it's due to the medication, some of it's due to lupus itself.
Wow. I can only imagine what a day is like for you. Only imagine. And the thing is, like, what would it have you ever, whether it's before or now, let's say, forgot to take a medication? And how did that really affect you? Because I'm trying to think, how would it affect you if you, let's say, today I'm not taking it? I just want to know, like, how dependent do you have to be on the medication?
So it's funny you should say that, because I had a really bad day the other day, and
Mhm.
I did forget to take my morning meds. And my morning meds are where my steroids are, apparently.
Okay.
And I was fine. I did notice my blood sugar was higher, because I was testing that,
Hmm.
the device on my arm. But I didn't feel like, all of a sudden, maybe 5, 6 o'clock at night, my joints were killing me, like
Mm.
really, really bad. I was like, why? And then I'm thinking I'm in a bad flare and whatever. And I just felt very weak and very tired all of a sudden. And I knew I was stressed because I had a very bad day. And
Hmm.
then I looked at my container of pills and I went, oh, I never took my morning meds. So it took
Hmm.
a good 12 hours before I felt something. But yeah, it definitely, I did feel it. And you don't realize how much your medication does for you until you don't take it. Like,
Right.
for instance, Benlysta, that's the weekly injections I give myself. I've been taken off of that before. If I've been sick, if I've been on antibiotics, they
Hmm.
tell you to stop taking that for a little while, and
Okay.
then, go back to it once you're off the antibiotics. And I don't think the Benlysta does anything anymore until I stop taking it. And then I'm like,
Mm.
oh, okay,
Mm.
now
Then
I
you
feel the
feel it.
difference.
What
And
exactly
now,
is it for? The what did you call it? Say that again.
Benlysta.
Yes, the infusion.
Oh, the infusion, Rituxan infusion is, um, it's actually initially for cancer.
Mm.
That's what it was initially for, but they're finding that Rituxan has been working for autoimmune diseases such as lupus. And
Hmm.
I find, for me personally, the best combination of drugs that I've been on has been the Rituxan, Benlysta, and the Plaquenil with the prednisone. I'd like to get rid of the prednisone, but we're
Hmm.
working on it. We're working on it.
But
That
you
for
find
me
that
has been the
those
best
help.
combination. I've been on, oh boy, I've been on many others that either I got very, very sick from or just didn't do anything for me at all.
Hmm.
I'm sure a lot of people out there who have lupus, they'll know about methotrexate. I've been on Cellcept. I've been on Acthar gel. And what was the other one? I can't remember now. Imuran. All of
Hmm.
those, either I got very sick from or did nothing for me at all. This has been
Wow.
the best combination.
Yeah. Wow.
But
I
the list is the only, that's very interesting. The only drug that's specifically made for lupus in all these years has been Benlysta. And that came out not all that long ago.
Wow. which shows that there needs to be so much more research done, because
Absolutely.
there's no way that you should be taking so many things and so many medications. And I know that lupus, the disease itself, it's literally attacking your body, and your healthy cells, your white blood cells. And that is why, so many lupus survivors, or warriors, I should say, are going through all of these things. And I know, just
Mhm.
hearing you, Ms. Kasbar, just listening, when I tell you I can't imagine, because that seems so much to me. And it's not that you're just dealing with lupus. You said you have diabetes, you're a diabetic, and you also mentioned something else, your arthritis. So it's a
Mhm.
lot of challenges, and heaven knows I'm praying and hoping that nothing else comes up, because you already have your cup full. But I want to find out from you, in the midst of all of this, when you're going through, what calms you? What is your go-to, or what helps centers you and motivates you just to go on with life?
So before I was sick, I guess pre-lupus, or before I knew I was sick, um, I was very physically active. I was a dancer. I liked to take walks. I would walk miles and miles a day.
Yeah.
I love cleaning my house. I would get frustrated or angry about something. I would love to clean. All those things were taken away from me. My
Mm-hmm.
exercise is very limited. I can't be outdoors the way I used to be.
Right.
And,
Mm-hmm.
cleaning my house isn't as much fun as it used to be
Right.
when you're in
Yeah.
that kind of thing. So I am still teaching. I was teaching before this, and I teach dance for a living.
Oh,
I've
nice.
had to, yes, I do teach dance for a living in a gifted and talented program. I've had to relearn how to teach. I
Mm,
can't demonstrate the way I used to. So for
mm,
me, first of all, those kids make me forget everything. I
mm,
focus on them entirely, and I want to give them all of myself and all of my creative energy. So that
mm-hmm.
has been, although at times I don't like to admit it, it has been extremely helpful in centering me and keeping me creative and keeping me busy. Um, but I've just had to relearn how to do that, how to use my words more often, and to use the students themselves, let them figure it out. Actually, it's made me a better teacher because I'm not
Absolutely.
doing everything for them anymore.
Right.
So that
Mm-hmm.
has helped. Actually, that's been tremendous. I also try to stay creative in other ways when I'm not teaching. I taught myself how to crochet.
Awesome. You
If
picked
you
up a hobby.
YouTube. I learned right off of YouTube how to crochet. And
Mm,
when my hands, actually, it's really good therapy for my hands. When my hands are feeling good, I love to crochet. Right now, my hands haven't been feeling so well, so the yarn is piling up. But
mm-hmm.
I want to get back into that as soon as my hands function a little bit better.
Mm-hmm.
I love to cook. Again, sometimes I can do it, and sometimes I can't.
Right. Right.
Um, so I just make adjustments based on what I'm able to do. But the creativity part of me, that needs to be constantly addressed. So however I can get it, that's what centers me. That's what makes me get through this. And yeah, my family too. My
Mm-hmm.
family, my mother's elderly, my brother's very sick, and I have to take care of them. So that's the
Mm-hmm.
two things that constantly keep me going.
Awesome. Awesome. Thank you. I'm definitely glad to hear that you are able to tap into, your creative self. And I know that that in itself, it seems, has helped you to find peace, and contentment. And it's definitely helping you to go on. I know you mentioned before that, you cannot go outside right now. You are in home. And I want you to just touch on that briefly. Like, how has that been for you? Where, you said before in the first video, you love the sun, you love to go out, you're typically, a dancer, and, your life has changed. And now this, in addition to your life changing, we're in a pandemic. And so that in itself has further, can be seen as like pushing you further into a box where you're trying to, break free from. How has it been for you at home, knowing that you can really go anywhere?
So it's frustrating. It's scary. The fact that I can't go to work right now.
Mm-hmm.
schools are open again, and
Mm-hmm.
I want to be at work and I can't.
Right.
And for now, it's okay. I've got my online classes at home or whatever, but I don't know what that's going to do next year. So that's
Mm-hmm.
scary because that's my job now.
Right.
Um,
Absolutely.
so that part really frightens me. Being isolated at home, as I said, because I've got this communication with all of my students still,
Mm-hmm.
I feel like I'm around people all the time,
Right.
even though I
Right.
haven't
Definitely help.
couch. So that part's been good, but if I didn't have that, I
Mm-hmm.
think it would be a lot worse. It's hard because I don't get to see my brother as frequently because it's dangerous for me to be near him and it's dangerous for him to be near me.
Mm-hmm. Wow.
Um, because he's been in and out of the hospital and stuff. So that part is really frustrating and frightening.
Mm-hmm.
But again, I'm grateful that at least this year I've been able to stay in touch with a lot of people. And I'm just hoping, like, I don't know. I don't know what I'm hoping for. It's frightening because I don't know if everybody out there understands how dangerous it can be
Right.
for somebody like me. So if somebody's running around without a mask on or whatever, it's
Mm-hmm.
really dangerous. And I
Mm-hmm.
don't know if I trust people. I don't think I trust them
Right.
at this. That's disappointing.
I mean,
But
I get it, because the thing about it is that a lot of people, and even if they say, I know about lupus, you really don't know because you don't live it. So I think that's a fair judgment to say that it's hard for you to trust. It's hard for you to say, okay, I can trust that you're being safe and all of that because you know what you're going through, because you know what life you live and how careful you have to be. So I get that.
right,
You know what I mean? So I wouldn't feel bad about thinking that way. I think that's just like, I have to protect myself. So, whatever I have to do, I have to make sure I do it so that I can protect myself. One of the things that I know you mentioned a lot about the medications that you're taking, and I just remember this. Um, does your health insurance cover all of that? Is that something that, if today I'm diagnosed with lupus, can I confidently say, like, my insurance is going to take me on and cover me and everything else that comes with that?
that's such a great question, and it couldn't come at a better time. So far, I've been very lucky. Between my rheumatologist really knows how to, write the prescriptions and request what he needs to request for me to get what I need. But as well as I guess I had taken out the optional riders and all that stuff before. So I had been
Mm.
covered for everything. But ironically, during this very bad week that I just had
Mhm.
with multiple issues, that was one of the problems. My insurance on my Rituxan infusion, I had one the other day, and
Mhm.
I'm supposed to have another one 2 weeks from now. And that infusion is questionable. They don't know if it's going to be done in the hospital that I've been having it done for the past 3 years, or I have to have it
Mhm.
at home. And there's something now that my insurance isn't covering. Um, where I'm getting the medication from for the infusion. So I don't know where
Mm.
I'm doing the next infusion and where I'm getting the medication from. And, this happens, with the change of administration and policies and things like that.
Mhm.
I'm just hoping it works out because that would be the first time in all these years since 2012 that I've been denied anything. And I really hope that's not the case, but there seems to be some adjustment going on with that. But I've been really lucky. I work for the Department of Education and they cover us very well. I have 3 different prescription plans. One is exclusive just for my diabetes medication.
Mhm.
One is exclusively for the lupus medication for Benlysta.
Mhm.
And then there's another one that's for everything else.
Okay.
So we have been lucky thus far. Let's hope those fingers crossed that
Stay
it works out
right.
for me. Yeah.
Absolutely. And I know you mentioned maybe the hospital administration changed, and that's why there's a shift in what's going on. And you know, the sad reality is that, and I'm very, very happy that you're able to get all of that covered. The sad reality of it is that a lot of people may not be in the type of job that you are in, and you know, even have insurance to get the care that they need. So I'm definitely hoping, because this condition definitely comes with a lot more than one person should be dealing with, for sure. So thank you so
And
much.
I'm sorry, I didn't mean to interrupt you, but
That's
the
okay.
other thing is that because of the pandemic and because of what's going on, I don't know what's going to happen with my job next year.
Mm,
So what happens if I can't work any longer? If I
right.
have to go out on medical leave, or what happens when I retire? Will my medication still be covered?
Mm,
And that's a lot of things that I've been researching now and trying to get information on, because I'm going to have to make some decisions in the future, and I may be in that situation where I'm not covered.
mm,
So I'm glad you're bringing awareness about that as well, because
yeah.
that's a big, big factor as to whether or not I could continue to work. And if I do work, then I'll have my, benefits. But then what happens if I can't work any longer? Then will I still get my medication?
Yeah.
And we don't know yet.
All
So
right.
that's a big thing.
Well, I do hope
Absolutely.
that, you know, we don't know what's going to happen with the pandemic. Unfortunately, that's not something we can change. But I do hope that, you know, your job is able to be accommodating and to help you remain home, knowing your situation, and you know, and that you will be able
Yeah.
to continue, because a lot of us lives have already shift and change in so many different ways. I think sectors now need to do that as well, or continue to
Yeah.
do that for as long as we're able, because we're not the ones who are in control of what's happening. So we just have to
Yeah.
do the best that we can. And I hope that sectors, you know, our jobs and everything like that, healthcare, our jobs can also be accommodating and support us in that way. Thank you so much, Ms. Caswell, for sharing your story. You have shared so much with us, and I do wish you all the best in your endeavors. And you know, we definitely will be praying for healing, because that may be the best thing, you know, for you at this point, and so that you can live as comfortably as possible. Thank you guys for watching Underneath Her Skin. I am here with Ms. Casbar, our lupus warrior, for today as we celebrate Lupus Awareness Month. Thank you for watching. We will see you in the next video. Bye-bye.
Thank
You're welcome.